be symptoms of that, criminal behavior being one of them. Obviously, problems with family and friends, loss of contact, isolation. So the earlier that we can actually get in, deal with individuals prior to them having to enter the court system on a criminal basis where their liberties are at stake. I feel very lucky that we have an intervention process on a civil basis. And I've really strived to move that forward in Broward County, and we've had a great success in Broward County. Basically, what it comes down to is, well, who is eligible for this? And it's generally somebody who has lost the power of self-control with respect to some substance, whether that be an illicit drug or a legal drug, being prescription medication. That they're likely to hurt somebody or themselves as a result of that. That can be they're driving cars, they're taking prescription medication to the point where they may overdose, or they're drinking to a point where they're falling down and really injuring themselves. Also, these people will generally not appreciate their own need for care. And the key being that they really don't have the judgment to make any rational decision regarding their care. So their family members or their friends or their loved ones are coming forward and saying, this person is not willing to, on a voluntary basis, get any type of assistance. And we need the courts to come in on a confidential basis and step in and assist us and monitor these individuals while they go through an assessment period, a detox period, and then subsequently entering into a treatment period.
You know, we were talking before the show, and I guess, again, I was saying we were doing a retrospective, and I guess you with your beautiful dark hair don't come into the same category as Jim and I, although I'm older than both of you guys. But the bottom line is that there's a real problem here, because you're doing a wonderful job advocating on behalf of these, what I would call impaired individuals.
That's exactly what it is.
A lot of people see them as addicts or you know, druggies, but they're impaired individuals.
And you're hitting it right on the head, because oftentimes it's a combination of a substance abuse problem with an underlying mental health condition.
Right, but yet we've seen over the years, Jim, the fact that Raymond is standing in a civil process in front of a judge or a magistrate or otherwise, trying to get these people into a proper facility, and for some reason, and maybe this is an editorial comment, maybe you agree or disagree with me, we as a society have not decided that we want to have enough programs or programs of help to these either mentally impaired or physically impaired individuals who are known to them as addicts or druggies. Is that true?
Well, unfortunately it is. And one of the real tragedies is that I think generally people do not understand that addiction is a disease from which recovery is very possible. And literally millions of people have been able to overcome this really fatal lifelong disease unless they deal with it. But in dealing with it, they are able to live very productive and very fulfilling lives. The problem is that often they, once they've had that success, they would just as leave that behind them and move on forward. But it's really important to share the important message of recovery, and that when people seek help, they get help, and that it works, and the treatment works for people. It might not work the first time, it might take several episodes, but in any medical procedure with a chronic lifelong condition, we need to have repeated care.
The point is that, and again, I know you and I have had this discussion a long time ago, but you know, this illness, or this, and a lot of people don't see it that way. They don't see this impaired individual, this addict, this junkie, this, you know, this druggie that people talk about. They don't see them as diseased individuals or sick individuals or impaired individuals. They see them as they are. They want to lock them up and put them away. Well, the cost of care is so far less than the cost of incarceration. I mean, I think incarceration today is somewhere in the neighborhood between $25,000 and $30,000 a year, a minimum, per person, whereas you could do a heck of a lot of I guess you can say, detox, rehab, and otherwise for a lot cheaper. Is that true?
The economy certainly is in prevention and in treatment and in care. Of course, it's criminal justice costs. It's also dramatically increasing health costs for individuals who are suffering from this disease. It's a number of factors. So the economy is best in paying for the services that really will serve society. So it's a cause that we like to say, well, gee, if those people hadn't done what they hadn't done, they got what they deserved. But the point is, we don't deserve to have the implications of the consequences of their abuse. We need to help them and need to restore them to full and productive lives, and it's possible.
Yeah, Raymond, you touched on something before, and I think it's very important because a lot of the notes and comments that we got that asked me to ask you to come to this show related to prescription drugs.
Yes.
I think that there's a much more pervasive use. This is, as an old pharmacist, I can tell you that there's a tremendous market out there because of the internet, because of in a sense, I don't want to blame certainly don't want to blame the drug companies in any way, but a lot of this direct-to-consumer advertising has brought, not that they don't advertise controlled substances, but the marketplace is out there. Do you see a lot of that in your situation?
It's big business, and people are profiting off of flooding our streets with prescription drugs, and I'm not to point the finger as to who's doing it, but the reality is it is happening.
Right.
I see it all the time. And in the last 4 to 5 years, the types of cases that we see coming through have gone from generally an older population to a far younger population. We've had cases come in now where people who are being filed against are as young as 11 years old. And you're speaking about polysubstance abuse, which is combinations of very dangerous drugs, amphetamines, cocaine, benzodiazepines, Valiums, Xanax, things of that nature. But very much one of the large problems that we're seeing in Broward County, and it's due, if greatly in part, to many of the overdoses that we're seeing as a result of prescription drugs, are the combinations of the benzodiazepines and the opiates. Oxycontin, obviously, most people are knowledgeable of that drug. We're seeing it all the time. In Florida alone, 7 Floridians a day die of a lethal prescription drug overdose. In 2003, there was approximately 6,700 deaths a year from prescription drugs. By 2006, that number had risen to 7,800 who will die in Florida. And these are, to put faces on them, these are the elderly who may be abusing prescription drugs. And as Jim knows, the elderly in Broward County are a major population that we have concern about with prescription drug abuse. But as well, these are mothers and fathers, and unfortunately, children.
Yeah, and you know, again, I know that the coalition, as you mentioned before, through the United Way and otherwise, have been very proactive, along with the police agencies, the Sheriff's Department and otherwise, that have now petitioned the legislature to, and this has been going on for a long time, to try to create an electronic registry for Class 2 and 3 drug products that are dispensed. Now, this is not in any way to impugn the integrity of any of our professionals, both medical professionals or pharmacy professionals,